Benefits and risks of antiretroviral therapy for perinatal HIV prevention. Definition: antiretroviral regimen used for the prevention of mother-to-child transmission of the human immunodeficiency virus (AEV) evolved from the first obsolete trial that used cytokine single-throat prophylaxis in 1994 to current three-protocol regimen. Although there are clear benefits of combination antiretroviral therapy for the mother and infant, these do not come without risks. Some studies have shown higher rate of observed pregnancy outcome with maternal ART than with regimen containing fewer antiretroviral agents. The primary maternal and infant survival everywhere promise that compared that relative efficacy and safety and various proven antiretroviral strategies for the prevention of mother-to-child transmission during pregnancy among asymptomatic HIV infected pregnant women with high CD4 count, result evaluating early transmission through the week 1 postpartum trial visits in uterine intrapartum or very early breastfeeding transmission are presented.
Antiretroviral medications are used to prevent the perinatal transmission of HIV from an infected mother to her baby, but this benefit needs to be weighed against the potential toxicity and adverse pregnancy outcomes associated with combination antiretroviral therapy. The PROMISE trial enrolled 3,529 women in the second trimester of pregnancy who had asymptomatic HIV infection with a CD4 count of 350 or more and randomized them to one of three groups. The zidovudine alone group received zidovudine during pregnancy, a single dose of nevirapine intrapartum, and tenofovir emtricitabine postpartum. The zidovudine ART group received combination zidovudine, lamivudine, lopinavir, ritonavir during pregnancy and postpartum. And the tenofovir ART group received combination tenofovir, emtricitabine, lopinavir, ritonavir during pregnancy and postpartum. Rates of discontinuation due to toxicity were low across all groups. The primary outcome was the percentage of neonatal HIV infections, measured 1 week postpartum. An interim analysis of the study demonstrated that the rate of early transmission of HIV was 1.8% in the zidovudine alone group, as compared with 0.5% in the combined zidovudine ART group and 0.6% in the tenofovir ART group, both significantly lower than in the zidovudine alone group. However, the zidovudine ART and tenofovir ART groups had higher rates of maternal chemical abnormalities than the zidovudine alone group. Zidovudine ART and tenofovir ART were also associated with more adverse pregnancy outcomes, such as low birth weight and preterm delivery. The authors conclude that combination antenatal ART resulted in significantly lower early HIV transmission than zidovudine alone, but at higher risk of adverse maternal and neonatal outcomes. Full trial results are available at nejm.org.
Pros and cons. The ART regimen in the protocol trial were portals inhibitor-based because nevirapine-based ART was contraindicated in women with a CD4 count of more than 250 cells per cubic millimeter, and efavirenz, the other available non-closed reverse franchise inhibitor, was contraindicated in pregnancy at the time. There are inconsistent findings regarding protease inhibitor-based RRT and preterm delivery. Some studies have shown that protease inhibitor reduce progesterone production in the trophoblast in vitro, and that low progesterone levels are associated with preterm delivery. However, other studies have shown that nevirapine-based ART is also associated with a higher rate of preterm delivery than zidovudine plus single-dose nevirapine. The PROMISE trial was not designed to compare protease inhibitor-based ART with NNRT-based ART, and we cannot comment on whether the current WHO recommended an ART regimen of tenofovir intercepting and ephedrine will be associated with a lower risk of a lower break weight of preterm delivery than the ART regimen in the promised trial. However, there was one other reason in that the combination of tenofovir, interceptin, and ephedrine was not associated with higher rates of adverse pregnancy outcome than cetobine-based ART.
You're watching UNICEF television. 22-year-old Saida lives in Djibouti with her husband and 2 sons. She found out she was HIV positive shortly before giving birth to her youngest, who is now 11 months old. Her oldest son is HIV negative, and her youngest won't have a conclusive diagnosis for a few months. A UNICEF-supported program provides drugs, psychological counseling, and even food rations when the family needs it.
PMTCT is very supportive. There's also a food program. Sometimes there's a shortage of food, and during this time it's hard.
Because of the nationwide program to prevent the transmission of HIV from mother to child, the scene in this consulting room, where a midwife explains the importance of an HIV test to an expectant mother, is being repeated all over the country. In this clinic alone, between 60 and 70 women are tested every week. From putting the newborn babies of HIV-positive mothers on an immediate regimen of antiretrovirals, to training more medical staff to spread the message of HIV prevention, UNICEF and its partners offer a holistic, integrated approach to HIV prevention in Djibouti.
La PTPE, ou la prévention de la transmission.
The benefits of the PMTCT experience in Djibouti is that it's allowed us to test more people and to make testing more of a standard procedure, extending knowledge to more health workers. In this way, it's helping to prevent the transmission of HIV from mother to child.
Because of the support of UNICEF and its partners, life has improved for Saida. She's become one of the first women in Djibouti to speak publicly about living with HIV. That testimony is positive for Saida and for the country. Djibouti has proven that a culturally conservative society can overcome the stigma that often accompanies HIV/AIDS. This is Chris Niles reporting for UNICEF Television. Unite for Children.
Application in medicine. The management of the pregnant woman with HIV infection as well as significantly over the past 25 years in light of advanced in drug development and greater understanding of the prevention of perinatal HIV transmission. In the United States and Europe, the risk of HIV transmission from mother to infant and decline to historical low level with the use of antiretroviral medication. Contribution to this successful prevention effort include universal transparency of pregnant women for HIV infection, the use of cesarean delivery when appropriate, and obedience of breastfeeding when feasible.
If you have HIV/AIDS and find out you are pregnant or think you may be pregnant, you should let your healthcare provider know as soon as possible.
Some HIV/AIDS medicines may harm your baby. Your healthcare provider may want you to take different medicines or change the doses. It is also possible to give HIV to your baby. This is most likely to happen around the time you give birth. For this reason, treatment during this time is very important for protecting your baby from infection. Several treatments may prevent the virus from spreading from you to your baby. Your healthcare provider can recommend the best one for you. Your baby will also need to have treatment for at least the first 6 weeks of life. Regular testing will be needed to find out if your baby is infected.
Use of playing in Ecuador. The Guide to Prevention and Control of Mother and Child Transmission of HIV and Congenital Syphilis and Conversational HIV AIDS care technical tool for health professionals involved in care. Pregnant and reproductive women, infant children infected by HIV, AIDS, and syphilis use it to improve and guarantee the quality of attention. It used to preserve the rationale in clinical care, reduce the variability of clinical practice, improving the health of patients with the objective of achieving a good quality of life. Conclusion. In conclusion, the perinatal shows superior efficacy of perinatal ART as compared with softline plus single dose nebulizer for the prevention of mother-to-child transmission in HIV-infected women with high CD4. Second but also show higher rates of birth. On the basis of perinatal, the who recommended ART for HIV-infected persons are regular of CD4. Second, and there are clear benefits of ART for the prevention of mother-to-child transmission and maternal health. However, it is also clear that the most efficacious and safe-serving ART regimen during pregnancy remains to be defined. Our findings in specific the need for continued research to assess ART in pregnancy to ensure safer pregnancy for HIV-infected women and healthier outcomes for the uninfected infants. Thank you.